Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my non-turkey gobblered co-host, Dr. J. Calvert.
Are you sure about that?
I think so. I'm pretty sure.
I think I'm ready.
I'm looking at you in profile. You don't have a gobbler on you. But
It's getting there.
But in honor of an upcoming holiday, one Turkey Day, we are talking about turkey gobblers.
The poor turkeys. Not only are they dinner, but they're also going to get abused for how their necks look.
I know, the poor things.
They need neck
We
lifts.
either gotta honor their beauty or kill them. I don't think we should do both.
They do need neck lifts though. That's their thing. I know. I'm telling you, I'm very close. I see my dad, and I know where this is going. I'm always like, Dad, I can do your neck for you. He's like, what's wrong with my neck? I'm like, nothing. Don't worry
Nothing. It looks great.
He's fine with it. He could give a crap at this point. He's out on the golf course. He's good. All four limbs are moving. He's
happy.
He's going to be at Thanksgiving dinner without a problem. He's a very happy dude.
But there are some necks out there that are quite extreme. Now, when we talk about neck lifts, there's certainly a whole range. A lot of times we get the patients that just, they're slowly seeing the signs of early aging. They just want to look a little tighter. They don't like the little bulge under their chin. These are all neck lifts and they do great. But then you have the patients that come in that have a gobbler. Yeah, it's big and it's noticeable and you're like, ooh, you're about 20 years late for your facelift.
It's the truth.
That's what it is.
That's the problem,
and
isn't it?
But they always think that, when they're 50, that it's too early to get a facelift. And they're going to wait till it's worse. That's the wrong answer. Because when you come to me with that turkey gobbler, you've waited way too long to get it done. And now we have a much bigger problem on our hands.
Yeah, that skin is an issue. And
It's a big issue.
Yeah, and there's a lot of it, and it's redundant, and it's hanging, and I just don't know why you want to wait till it's hanging over your collar, which is really the truth. You button up your collar, put on your tie, and then, there's this skin that, it looks like if you stretch it out, stand at the front of the boat, you can sail to Catalina with it. It's just too much skin.
It can be a lot. It can be a lot of extra skin.
Yeah.
And so a lot of the principles of this neck lift are similar to any other neck lift, but there are a few additional things that we have to take into consideration, and there are a few other things that patients sort of need to know expectation-wise about this surgery.
Well, and also I think, the take-home message, which I think you've already hit hard, was the don't be late to this operation. Don't wait till you have this, terrible neck. Well, don't wait till there's skin hanging over the clothes and stuff like that. That's not the time.
It's not the time
to show up for the facelift.
Because A, you've already spent, 15, 20 years of your life with probably a neck you hated. And B, your results are not going to be as good as if you had just done it when it was not so bad. So there are many reasons why people don't, and I get that. I respect it. But that is the problem, is that you're a little late to your facelift. So this is not someone who's going to be getting a lunchtime facelift or a weekend facelift or a little mini facelift. No, this is the full shebang. You're getting all the cuts. This is not just your neck. We got to lift up everything. So these are incisions that are going to go up in the hairline, above the ear, around the ear, behind the ear, into the hairline. You're going to have an incision under the neck. Because there's so much skin, you need all of these cuts to be able to remove all of it. If you try and piecemeal it and just do little tiny incisions, you're not going to get it. Just a quick sidebar, because this is annoying me now that I'm thinking about it. I had a referral a few weeks ago for a lady in her 70s who has this turkey gobbler, and she's been going to Mexico for the past couple of years getting thread lifts. Bless her heart.
Oh, my God.
Someone is taking this woman's money and just scamming her.
Totally.
There is no way on this earth that those threads are going to be able to lift this amount of skin and do anything with it. She's like, I don't think they're working. I'm like, oh, no, they're not.
They're not.
They're not. Because you know why? You need a neck lift. You need surgery. You need a knife to remove all that extra skin. So just buyer beware. If it sounds too good to be true, it probably is.
Yeah, the threads, I think, they're very temporary.
They're temporary. They're not designed to lift massive amounts of skin. These are not anti-gravity devices. These are for people that just have maybe a little bit of extra skin. We're not going to do the thread lift talk right now. That being said, lots of skin. You need some big skin incisions.
Yeah, we did hit the thread lifts hard with Kimberly Cates.
Yeah.
So refer back to the Princess Kimberly Cates, the podcast about the threads. She'll tell you her experience.
But this is a neck lift, but it's a full face lift to be able to treat it properly. And I think that's something that's important to know. These necks are not something you can treat in isolation. You got to treat the whole face to be able to re-drape the skin in a way that looks nice and natural and appropriate.
Yeah, I mean, there's a lot of interest with. I've seen a couple of plastic surgeons who really try to avoid making the incision in front of the ear, basically around the tragus and all that. And I think that's noble and valiant, and I think it's absolutely completely unnecessary. And I find it's probably just, kind of, the plastic surgeon trying to please the patient,
right?
Because the patient's ill-informed, and they don't want to say like, no, it's going to be better if I make this incision. Like it's like, we can do it without that, but if you really want to have a good, clean jawline with an amazing result. Why are you fighting the incision? It's like not a big deal.
It's not a big
if you
deal.
hide it right and you sew it properly and my patients don't ever complain like, oh, you can see the scar.
Nope.
Like, I have had 1 keloid on a patient. It was a 72-year-old, white lady, because everybody thinks of Asian patients and African American and darker skinned patients as getting keloids. This is the 1 keloid I've had on facelift patients, and I don't know why. It's usually because of tension, but I'm known for not having any tension on the incisions when I close them. And so, for the most part of the other, 750 facelift patients I've done, I just haven't had those kind of problems.
The face, in general, the face is very forgiving and heals very well. There's a lot of blood supply to the face. It tends to scar very well. And with well-placed incisions, we've talked about this before, well-placed incisions, no tension on the closure. These incisions usually heal very well. And usually what I hear actually is, oh yeah, I went and had my hair done and my hairstylist was so impressed she couldn't even find my scars. So give it enough time and those scars, they go away. But if you want a nice looking face and you want all that extra skin of your neck removed, you need those cuts.
You do.
You need those cuts.
The skin doesn't come out by magic.
It isn't. And it's, the other population, other than the late to the game facelifters that I see this in, are my weight loss patients.
Totally.
Same kind of issue, right? Because they have lots of skin after they lose weight. The skin is not great quality. And so they have the turkey gobblers and they need big cuts just like they do everywhere else in their body. They need those incisions to remove all that extra skin.
Yeah, I have a weight loss patient coming up now in the next 2 weeks with for a facelift, full everything, and man, does she have some skin?
They have some skin. So, what do you tell your patients? I mean, the really extreme ones, right? The ones that literally can sail to Catalina with their skin.
Like that visual.
Literally, yeah.
Right? Here we go.
Everybody on board?
Come on.
Heave-ho. What do you tell them about the need for a revision? Are you going to be able to get all that skin out in one go, or will they need maybe a touch up?
I almost plan on it. I rarely need to do it, but I do tell them exactly that. I said, look, this is a ton of skin. And it's not that I'm not going to get it tight. I am going to get it tight, but the skin's going to relax because the weight loss patient, especially, their skin has been stretched so badly that the elasticity of the skin that's left over after removing it is not good.
Yeah.
And so I'm going to get it looking amazing on the table, and I'm going to have it as tension-free closure and all blah, blah, blah. All those good things. And then it's just going to relax. It's just relax.
That being said, because I say this to all my patients with the weight loss, yes, I'm going to pull you super, super tight. These are for my tummy patients. But within a few months, it's going to be loose again. That being said, you're still going to be 90% better than you were before.
Of course.
And it's not the kind of looseness that's really noticeable to the average person. You're going to notice it. If you play with it, you can feel that it's a little loose. But 90% better. If you want to get to that full 100%, we may have to come back and do a little bit of a touch-up down the road.
That is the party line.
Yeah.
And with these patients who have that bad turkey gobbler, part of the trick to, I know you don't want to get into the weeds too much on the technical, but I do think addressing the digastric muscles, which are the muscles that kind of hold there's a bone in your neck that people don't really know about called the hyoid bone. And it's kind of what defines that cervico-mental angle, the neck to the chin.
Yeah, that sharp, defined neck. Now, some
Right.
people, you look at them in profile and they have like almost a 90-degree angle between their chin and their neck. And some people have like more of like a
180 degree.
or diagonal line. And a lot of times that's not fat or skin. That's just the structure of how your neck structures are designed.
That's right.
Yeah.
And you can do something about that by working the digastric muscles. Typically what I do is I wind up dividing the anterior belly of the digastric muscles, which allows the hyoid to sit back.
Right.
And it deepens the neck.
Yeah, that's great.
And this is for people that have, that big bullfrog neck or the turkey neck, and you want to get a little more distance from the chin to the cervical mental angle, to that angular part where the chin and the submental region, the area under your jaw, goes down to the neck. That works great. Working on the platysma muscles, the flat, your
bands,
muscles, your bands, working on those muscles is also very helpful. I a lot of times wind up just dividing the platysma muscle and bringing it laterally and cleaning things up that way. And so there's a lot of options. Taking out submandibular glands is not something I do a lot of. It's in vogue right now to do that. Where
some people need it.
Some people do need it, but it's not. It's pretty rare in my book.
Yeah.
There are issues with that. I just had a patient present to me from another surgeon who was dealing with a terrible sialocele, and that's where you've cut the gland and it's just making saliva in your neck. And so I don't love that. That does happen. Hasn't happened to me, and because I do this pretty rarely. But there's a lot of technical approach to the neck that you want to be, as a surgeon, you want to have all those tools at your disposal, and you want to also, before you go into surgery, make the proper diagnosis of what you really need to do to get a great result for your patient. And these turkey necks are the ones where you really got to pay attention.
You really got to pay attention. You got to have a solid plan. It's not just about the skin, like you said. There's all these deeper structures you have to address, but also a lot of it is about the skin. You got to get rid of it. You got to pull it. You got to get rid of it. And these are some very satisfied patients. I mean, to go from having that gobbler to having a clean, defined neckline, it's huge.
Yeah, I mean, it's great. I'm up for it myself, so I'll be ready when you are. Maybe not on Thanksgiving, but soon enough. It's time. And I do think that for the the person who's thinking about like, well, can I just get a neck lift? Yes, you can. I don't do that. I always wind up bringing up
the lower face,
because if you only do the neck, then you're going to have your whatever jowl issues going on is going to be worse because you want to clean the jawline. That's the whole point. A facelift is a neck and lower facelift. That's what a neck lift and a lower facelift. This is what that operation's about.
This is a continuous unit, and when you try and break it up into just the neck and just the face, a lot of times it's not that the patients don't know. That's the thing.
Right.
They don't know.
You have to educate them.
They see the neck as a problem because for them that is the most obvious thing that is of concern to them. They don't understand that it's actually connected to the lower face and to the jowls. And I know what they're saying when they say they want a neck lift. I know the result they're looking for. They want a clean jawline and they want their neck cleaned up. To do that, you need to do the lower face.
Right.
There's
it's
just
lower
no way
face and
around
neck
that.
together.
Yeah.
Yeah,
if you want like a subpar result, then we can just do the neck lift.
Yeah, but I won't do that. I would rather spend some time with the education, and I just think there's so much I don't know. There's so much misinformation on the internet.
Yeah.
It just makes our job a lot harder.
It's really hard. I have a really hard time, to be fair, about doing things that aren't going to make it look best.
No, I don't want to do that.
I don't want to do that because I hate it. I hate it. I hate it. I hate it. It's this very like anticlimactic feeling when you're done, when you're like, ugh, wish I could have done this instead.
Yeah. Why not do the right operation?
Yeah. So,
But that's our job. Our job is to give the patients the educational boost that they need, to remind them that the internet's the only place where you could spend time trying to learn and actually wind up dumber when you're done.
like a few
when you're done.
brain cells down, a few IQ points down.
You can hear like it's just incredible.
It's just a
the stuff that you
sinkhole,
read.
like a cesspool of information.
I mean, some of the stuff that people, I just go, no, that's not real. That's not how that works. That's not it at all.
No.
What? Where'd you hear that? Oh, well, I read on, blah, blah, blah. I'm like, that's
I read
not
it on
true.
Reddit.
Yeah, I mean, Reddit, Reddit, you can get a lot of good information. You can get a lot of stuff that it just isn't true. That's why I think it's really hard to discern it. And the best thing to do is go to a board-certified plastic surgeon who can give you the educational piece, that can tell you, what's possible, what's not possible, and at least they can spend some time with an evaluation, making a diagnosis, and then recommending treatment.
Yeah.
Then you'll have some information that's worth something. But, this concept that, threads are the answer, I'm not going. I feel like I'm going to go, but I'm not going to go. Because I feel a rant coming there, and I'm going to Thanksgiving. I'm going to be thankful that we have the information and we can disseminate it as proper information on this amazing American holiday of ours.
And I think that's it. I think we just wish everyone a very, very happy Thanksgiving. If you have a turkey gobbler, come on in and get evaluated. You don't want to end up on the kitchen table.
That's so bad.
It's so bad. It's so bad.
All right, I'll be in next week. I'm ready.
And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.